Brian, when people search for vitamin D, I think they are really asking a practical question. What could it actually do for my body?
Exactly. The honest answer is not that vitamin D is magic. It is that when your status is low, this small nutrient can touch several systems at once. And low status can be hard to spot. Fatigue, bone pain, muscle weakness, or cramps can point many directions, so the story needs context. So we will climb this in the right order. How vitamin D becomes active, what benefits are best supported, who should pay attention, and where the safety line sits.
Before we talk about benefits, can we start with the basics? How does vitamin D even get into the body?
Yes, and this is the part many quick videos skip. Vitamin D does not enter ready to do its main job. The body has to process it first. First, it has to travel through the blood, almost like a raw ingredient being carried to the organs that will process it. The liver makes the first major edit. It turns incoming vitamin D into the storage form doctors commonly look for in a blood test.
So if the symptoms are vague, is that why people talk so much about blood tests?
That is the idea. A test is not a perfect story by itself, but it gives a better starting point than guessing from tiredness alone. Now the story reaches the gut. Active vitamin D helps intestinal cells handle calcium more effectively. The practical result is simple but important. More of the calcium you ingest can move from the intestine into the bloodstream.
Okay, now give me the benefit spectrum. Which benefits are firmly established and which ones are more like social media claims with some evidence but not final proof?
The strongest starting point is established physiology, calcium, phosphate, and bone mineralization. That is the mainstream medical core. For children, the benefit becomes very concrete. Severe deficiency can disturb mineralization while the skeleton is still forming. For adults, the serious deficiency story is bone reliability. Severe deficiency can soften mineralized bone, which is why bone pain and weakness belong in the conversation.
People also mention weakness, cramps, and falls. Is that real, or does the internet stretch it too far?
It is real biology, but it needs context. Vitamin D can matter for muscle and movement resilience, especially in higher-risk adults. But falls are always multifactor. The first internet claim is immunity. That one is not invented from nowhere. Immune cells can respond to vitamin D. But respiratory infection reviews have moved from modest signals to weaker, updated evidence. So this is not reliable cold prevention. The second claim is autoimmune risk. Here the evidence is more interesting than a vague wellness claim. The VITAL trial reported fewer new autoimmune diseases over follow-up. Still, that is prevention evidence, not treatment advice.
The energy and mood claim is everywhere online. Is that actually supported, or is it mostly people trying to explain why they feel tired?
There is also a real metabolic claim. In prediabetes, trials suggest vitamin D can reduce progression to diabetes, but it belongs beside lifestyle change, not instead of it.
Cancer and inflammation claims are the ones that make me most cautious. How do we say something useful without making it sound like treatment?
Exactly. Then for hair, skin, and general wellness, we say what the evidence can actually carry. Associations exist in some studies, but supplement proof is still limited.
Who should pay closer attention in real life? I mean, who is more likely to have low status?
One obvious group is people with limited sunlight, especially during long indoor months or darker seasons. Diet can matter too, because natural vitamin D food sources are limited. And absorption matters. If the gut has trouble absorbing fat-soluble nutrients, the usual dose conversation can change completely. Age, body composition, medications, and medical history can also shift the decision. This is why one-size-fits-all advice breaks down.
So why not just tell everyone to take more vitamin D and be done with it?
Because guidelines are more cautious than the internet. More is not automatically better, especially if someone already has adequate status. For broad fracture or fall prevention, the evidence is not a clean, more is better story. That boundary is important because it prevents false confidence. Testing is most useful when the result would actually change the decision. Risk factors, symptoms with context, or a clinician choosing a dose. Dose should follow status, diet, risk, and medical context. It should not follow social media momentum.
What is the safety edge? What are we trying to avoid with high doses?
The big concern is that too much vitamin D can push calcium too high. Some evidence reviews also raise kidney stone concerns when vitamin D is paired with calcium. If kidney disease, granulomatous disease, cancer, pregnancy, medications, or complex conditions are involved, do not improvise. Bring a clinician into the decision. A better order is this: understand the mechanism, identify risk, check status when it matters, choose dose, and follow up.
Before we close, what sources are you leaning on for this? I want viewers to know this is not just opinion.
The authority layer is medical references first: NIH Office of Dietary Supplements, Medline Plus, Endocrine Society guidance, and USPSTF evidence reviews. Public videos are useful for questions, but not the authority for claims. So the bottom line is not take it or avoid it. The better question is, do you have a real reason, a likely benefit, a sensible dose, and a safe plan?